Okay, hello and welcome to Catalyst for Healing. My name is Dr. Yanuck. Finally back with our wonderful therapist Maria Lloyd in the same room.
Yep.
We've had some kind of disparate podcasts and episodes where I've been with Dr. Richter, or she's been with Dr. Richter, or I've been with myself, but now we're back together, the team's here.
Yep.
It's feeling good.
Good to be back.
It's good to be back. Okay, so today's episode is going to focus on a specific cohort of patients, and that is patients with anxiety. So we're going to focus on the unique considerations for undergoing a ketamine infusion with anxiety. We're going to focus on the considerations before, during, and after. And we're going to kind of work together to discuss our experience with these patients and ultimately what we think should be optimized to get the most from the experience for each of those patients.
Yep.
So when it comes to anxiety, what do you see as kind of the biggest hurdle overall for a ketamine infusion for them? Like when you work with these anxious patients, what are the things that they're oftentimes verbalizing to you that you feel like is inhibiting them from getting the most from the experience?
I think with the anxious patients, the biggest inhibitor is that I think not being able to release control. So that's kind of one of the things we focus on a lot in the preparation is what is it going to be like to show up and just fully surrender control to the experience. Because most patients with anxiety, that's kind of the primary thing is they're trying to control a lot of aspects of their life. And this is kind of the ultimate experience of having to release that and not know exactly what's going to happen. Mm-hmm. And so it can take a long time to prepare them mentally to kind of get there. I don't know, what do you
for sure.
notice?
So when my first interaction with the patient is the consult. And so oftentimes, without even them telling me their story, I can really quickly learn who's the anxious patient, who's the depressed patient. Obviously, everyone's got an overlap.
Sure.
We're talking about whether you are predominantly anxious or predominantly depressed. But this is the predominantly anxious cohort. They are often immediately bombarding me with questions. Right? They want to know, how do you come up with a dose? How many infusions do you do? Right. What are the most common side effects you've seen? Boom, 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 boom. Because they need to have. The more information they have gives them a sense that they have some more control over the experience, right? And that's how they navigate all aspects of their life. And I think as the provider, it's my job to both simultaneously make them feel as comfortable as possible, but also set them up for trying to relinquish control during the actual infusion and beyond, right? Because that's really the core of anxiety, is starting to relinquish control over every aspect of your life.
Right.
Because that's how they get through. And so during my consults, oftentimes, aside from them asking a lot of questions, it requires a lot of hand-holding to get them into this space, right?
Yeah.
If I feel like they are a candidate, if they've decided they want to move forward, typically my encounter after that would be, sending some basic paperwork and having them come in. With the anxious patients, there's probably 10, 15 more conversations that happen between my consult and then coming in here. Right. Oh, I forgot to ask, is it okay if I take my Zoloft in the morning? Or is it, on accident, I took a sip of coffee from this morning. I made a huge mistake.
Right.
I just heard this, right? And so I try and tell them ahead of time, no matter how much information I give you in this space, you're going to be anxious.
Right.
And when you enter this room, you are going to be extremely anxious.
Yeah.
But we've been doing this for a long time. We've worked with patients just as anxious, if not more anxious than you.
Right.
And you just have to trust the process.
Yeah.
And so if they can get into this space, almost always, then we can kind of move them through the process. But getting the anxious patient here is really difficult.
Right.
Yeah. Oftentimes before they come into us, they will see you for a session or two for therapy.
Yeah.
When you're preparing an anxious patient that you sense is really anxious to how to navigate the experience, what's some wisdom or what's some things you're giving them to how to navigate the actual infusion?
Yeah. I mean, I think what you just said, allowing them to ask all the questions, because for anxious patients, they go to what's the worst thing that can happen. Mm-hmm. And they're already playing it out in their head to kind of make sure they prepare themselves for that.
Yeah.
And so I like to kind of push on that a little bit. So it's what is it the worst? What is the worst thing that you're afraid of? Make them face that. And then we can talk through, okay, well, how would you work through that if that happened?
What's the most common answer you get to that? I'm curious.
I mean, the biggest one people are afraid of is going crazy.
Okay.
Like, let's say they have some undiagnosed bipolar they weren't aware of, or schizophrenia, and I reassure them of the statistics. I mean, what would you say the statistics are of that? With family history. Yeah.
We've talked about this before, but I do get that question a lot, and I will walk them through their family history, if they've had prior psychedelic use, all these factors that can like help me give them my best estimate. But the risk is insanely low for the people that are coming in here, less than 0.1%. For the people that are actually coming into this office, for sure.
Right.
But it's interesting you say that. I would say that the most common worst case that patients say to me is that this is not going to work for them.
That's another one.
Yeah,
for sure.
But I guess they kind of go hand in hand. It's not exactly, but like those are like the two biggest fears that they oftentimes have. It's not like the logical, most extreme fear of like I'm going to lose my life or something like that. It's like I've already lost my life and this is my last hope, and I think that this might not help me.
Right.
Yeah.
Well, that's a definite fear, and then we walk through. Okay, well then let's go through that scenario. So let's say it doesn't work. You know, do you think there's things that you might learn from the process, or maybe then it helps determine your next step with another type of treatment? So again, just kind of leaning into the fears to try to flesh them out a little bit, I think helps people take that next step. I definitely notice the anxious clients are going to, I mean, what is the efficacy that you're seeing in terms of statistically compared to the depression?
I don't think I could give like a specific number just because like I don't have a comparative trial like that cohort versus that cohort. But I think the patients that are more anxious definitely require more work on our part, and their part, and your part to get the same efficacy that someone would with just pure depression or PTSD. That's not to say they can't have success, but it's like if they're just coming here thinking they're going to get the medicine and it's going to immediately fix them and they go home like that it ain't going to work for them.
Right.
Where with the depressed patients, occasionally they can come in with that mindset, and they can, right? Because like the medicine can be that powerful to like unlock the hope and the and that kind of feeling. Now, when they come into the clinic, you know, anxious patients, their legs are bouncing, or they're really closed off. They're not making any eye contact. You know, you try and engage with them and get a sense of like, hey, like, so normal to be nervous here. Everyone's nervous. This is your space. It's your space to be free and open.
Right.
Nothing you say here, do here is going to leave this office. Like, we try and do everything we can to kind of orient them to where we are. I try and walk them through everything to the best of my ability that they're going to experience. They like to have an idea like of like each step, like, okay, 5 minutes in, what am I going to feel? 10 minutes in, what am I going to feel?
Right.
Obviously, you know, I caution it with like, it's not always that way, but you know, for the most part, we have a general sense of where things are going to go. When they do actually start the infusion, though, the last thing I try and tell all my patients, but I really emphasize with my anxious patients, is just let go.
Yeah.
Your whole life you've been holding on. Just just go, let it go.
Yep.
And almost always they're not able to do that, and that's totally okay.
Yeah.
And I don't tell them ahead of time like you're not going to be able to do this, but like I think it's important to understand that there's a reason we do 6. It's not just because of like the additive effects of the ketamine, but it's to orient yourself to this space and get more comfortable with it and feel more safe with it so you can let go.
Right.
A lot of anxious patients will be on, you know, medicines for their anxiety. A lot of them are on benzodiazepines, which you know, can be very effective medicines, but at the same time are purely just Band-Aids.
Yep.
A lot of these patients will ask, you know, can I take that medicine beforehand? Are you going to give me medicine during? And it really depends on the individual, right?
Yeah.
If you're on the far end of the anxious spectrum, like where you're already basically having a panic attack in the chair, I'm going to pre-medicate you with Versed, or like some benzodiazepine, basically.
Right.
But if you're...
Does that lower the effectiveness of the infusion?
It's controversial. It will definitely lower the experience. So in terms of kind of like the vividness of the experience in all senses, like visually, auditory, feeling, it blunts it. In terms of the actual effectiveness, there's mixed evidence on that. In my experience, I don't think it does. Okay. Because I think, but it's also like, I don't know how these people would get through it otherwise, you know? So if they need to do it, they do it. But I think we try and, you know, if they're going to do it the first time, the next time we're like, hey, let's try half that dose. Then let's try half that dose. And then let's try it without it. We have it right here. If you need it, we have it. Right? And a lot of patients are able to after the first or second month get through it. Like just today, same thing. We had that.
Right.
It's like patient's third time didn't require the medicine, or required a very low dose of the medicine. If you have your own medicine, talk to the doctor ahead of time. For me, I will usually tell patients, you know, if you've got your Xanax that you take 3 times a day in the morning, don't take it. If you come here, if we really feel like you need it, we can give you something here, but I would really love to try and not have that in your system.
Yeah.
But with benzos, if you're taking multiple doses a day routinely, it's not something that you just stop.
Right.
So when you go home, I'm not going to tell you to not take it. You should take it as you normally would.
Right.
And then under the kind of supervision of your doctor or psychiatrist, that it's something you maybe could come off of in the future. Hopefully can.
Yeah.
During the infusion, our anxious patients, it's usually one of two things early on. It's they felt almost nothing, or they have a panic attack.
Oh, interesting.
Every once in a while, they have like a quote normal kind of big experience, but the feel almost nothing, I think, largely has to do with the core causes of anxiety, and that is just this overpowering ego and constant, like, I have to control this.
Yeah.
Like, you're gonna throw stuff at me, ketamine, but like, I'm just gonna move it away. I might be seeing stuff, nope, I'm here, I'm in reality. And these are the people that are pulling their eye mask up, they're looking around, they put their headphones off, they want the music really low. And then the other patients are, the second they feel the molecule touching them, like they're like a little tingling sensation, they start to spiral.
Okay.
And so our job in this space is to kind of de-escalate.
Yeah.
And so if I see that happening with an anxious patient, my job is to set it ahead of time how we're going to address this. Right? Like, hey, are you okay with if I see you kind of starting to escalate with physical touch, like if I grab your hand, or if I touch your headphones, like they should know ahead of time what I'm going to do.
Yeah.
Are you okay if I turn down the music and we talk? And so typically I'll try and verbally de-escalate them, orient them where they are.
Yeah.
Everything's going well. This is exactly where you should be, how you should feel. And if that doesn't work, then we will give a benzodiazepine. But rarely are we doing that, truly.
Good.
And then each session after that, you know, I'll have conversations with them the next day. You will meet with them the next day or the day of. And we slowly but surely start to get comfortable with that space. Yeah. So what is like, you know, an anxious patient that's coming to you for therapy, let's say after an infusion, what are the typical things that you find them discussing and the questions they're having for you that might be different from other clients that you have?
Well, I mean, I think, so the anxious patients are often focused on like the present, right? In terms of the things in their environment they're trying to control, or the things that they're aware of being able to control. But I think what I'm able to get into is underneath and what some of the early triggers might be for some of these anxious patients. So the goal is to understand, like, where did that really develop in childhood? Because really it all comes down to trauma and what we're learning in all of, you know, all of both of our work is basically at the core, there were some things in their childhood that kind of had them put on these protective parts and take more control of their life to protect themselves from getting harmed again. So
do you find with
over time I try to chip away at figuring that piece out, because then we can work on the kind of the root issue. Right.
Do you find that patients get frustrated if they can't find, because I think some patients are like knowledgeable enough about this space that they're like, okay, like I need to unlock that trauma, that one thing. Do you find sometimes patients getting frustrated with like feeling like they're not finding why they are the way they are, and how do you navigate that as a therapist?
That's a good question. I think there's always space to explore, and so if they're really focused on finding kind of the one thing, they're going to get frustrated. But if they're open to the process, I mean, I think the fact that they're here and the fact that they're engaging in the therapy, they're kind of open to exploring, at least opening space to try to figure out what's going on. So they're going to figure out some things, maybe not like the one specific thing, but once people start putting pieces together, like I had a client today that I was talking about where, you know, there's so much present anxiety going on, and we were finally able to unlock this fear of getting older. It's an older patient, and the fear of death, and this move represented, you know, maybe like a final move in his life. And like that was really at the core of all of these anxious, like grasping behaviors that were coming out day to day. And somehow just understanding that and unlocking that calmed the nervous system down for that person. And so oftentimes it's just through like opening up the space to explore that we'll uncover what's really going on underneath some of the behaviors, if that makes sense.
Yeah, that's so interesting. I find that the anxious patients for me on my follow-ups post-infusion are really focused on any perceived side effect. And so,
I could see that.
For example, brain fog, really common side effect. Actually, I'm starting to reframe it as not a side effect, but like a positive effect that the ketamine's working. I'll go into that in a second.
Okay.
But other side effects are nausea, objectively a side effect, headache.
Yeah.
Some people get constipation. Those are kind of maybe the common 4 things that we hear people say, and they will oftentimes perseverate on like, is this normal? Should I be feeling this? Like, how long will this last for? And like, they're so stuck on that that they can't even like comprehend if anything else is advancing or work on things that they want to work on.
Right.
And so I've noticed that spacing out infusions for anxious patients tends to be more efficacious than keeping them really close together, because it gives them let's say a day of dealing with the after effects, and then a day or 2 where they can start to sense with some clarity, like, is something changing?
Yeah.
And then they get another dose, right? Rather than the traditional like Monday, Wednesday, Friday.
Oh,
that
that's
can
a
be
good
too
point.
intense for them. They don't get any
So maybe more
any
like
breath of
once a week, or do you think later?
Twice a week is what we typically do.
Let's spread it out more.
Yeah, exactly.
Okay.
Like maybe not every other day. And then, of course it depends on the individual,
Sure.
like what their schedule is. To the brain fog point real quick, I
Yeah.
think, there's a lot of theoretical ideas for what can cause the brain fog with ketamine, but my hypothesis is that it has to do with this massive expansion in the neural connectivity of the brain, right? As you get the neurogenesis and the plasticity, our brains are designed, as we get older, to be really efficient, right?
Yeah.
They're not designed to think about things in different ways. That's not efficient, right? When you see a car coming towards you, you don't want to have to think about what is that. You just need to get the hell out of the way, right?
Yeah.
And so I think with ketamine, especially with multiple doses, all these centers are starting to talk to each other and communicate that we're normally dormant.
Oh,
and
that's interesting.
For me, a signal like, hey, this is working. Like, your mind's starting to open up. And yes, it's manifesting as you're not able to come up with the words that you normally would do, or maybe you feel slower, overwhelmed. Like, that's going to go away. Like, the dust always settles on that after a couple of days.
Great.
But the anxious patients really lock into that of like, this is not how I want to be.
Right.
And so it's important as the provider to prepare them for that. This is very likely going to happen, and when it happens, it's okay.
It's normal.
But also to emphasize when it does happen and they are worried about it, hey, this is normal. It's working. This is happening, right? And of course, there's always important considerations that I have discussions with the patients, but on the whole, these are normal things.
But that's a really good point, because they are going to be more aware of the body sensations.
Absolutely.
And I think I like that, to reframe it as like, this is actually working then. We know it's working. And to normalize it. Anxious clients are going to also adjust more slowly to change. And I like the point of like, maybe they do Monday, Friday instead of like Monday, Wednesday, Friday, or Tuesday, Thursday.
Right.
Just to give them a little bit more space to like settle.
Yeah. Absolutely. I think that could be really effective for them. And then I think on the whole
and then we go back to the nervous system regulation. So when we can incorporate that part in anything that we do that helps regulate the nervous system, whether that be breath work, meditation, all of those things for the anxious clients are like crucial.
So true, yeah, and that's.
And you guys have just incorporated that more.
Yeah, and something too. Sheila was on a prior episode. Encourage you to listen to that. She has one on breathwork and meditation that was really interesting and eye-opening for me. So we've incorporated into our practice in a more formalized way, where all of our patients are getting like training in it.
Yeah.
It's ultimately up to the individual what they decide to do. But the beautiful thing about ketamine is it can facilitate forming habits, and so we at least tell patients, just for the 3 weeks you're doing this or 2 weeks you're doing this, just commit to it.
Right.
If it's not for you after that, that's fine. But just like you're financially committing to this space. At the least you can do is try and get the most out of it.
Right.
And I agree, especially with our anxious patients, breathwork and meditation is critical.
And they're the most resistant to it.
Of course, yeah.
Of course.
I can attest to that, yeah.
And so I think that's always a good conversation to have, because they're like, no, I don't do those things. And it's like, those are the things that are actually going to help you the most, because your breathing's going to become, short and quick. Your body's going to be tight. The more anxious you are for a treatment, the harder it is going to be to get in that relaxed space to really get the most out of it.
So I think, maybe to close, I think it could be interesting to, if we were a patient, if we were like an anxious patient, what would we recommend to anxious patients if they're seeking consultation for it? Like, how can they communicate to the provider to best help them? I think from a clinical standpoint, maybe you could talk from a therapy standpoint. From a clinical standpoint, I think you should, one, the provider is gonna understand, right? They've worked with plenty of people just like you. You're not annoying us. You're not a burden on us. Like, you're the person we're trying to help. Right. But I think it's important to communicate your needs up front and be really clear with it. Everyone needs something a little bit different. And so if you're someone that really needs like clear and concise answers to all these questions, if you're someone that needs to be constantly reiterated that this is a safe space, that someone's in the room with you at all times, right? That not every clinic does that, but sometimes for anxious people that can be really critical. Just communicate with that. And if they can't offer you what you need, like, don't settle for anything less than what you deserve and need, right? We are getting to a point now where there are enough spaces, maybe at least coastally, if sometimes in middle America I can't say for sure, but you should be able to find someone that fits your need in this space. You're ideally doing this one time in your life, and you really want to optimize every part of that experience. And so if you feel any sort of way that they're not acknowledging what your needs are as an anxious patient, like, okay. If they can't address it, move on. What do you think from a therapy standpoint, unique considerations like working with a therapist that an anxious patient should relate to you or think about?
Well, I think finding the right fit. So they have to feel really comfortable with the therapist, because anxious patients would have a hard time with someone if they didn't feel comfortable. Asking all those questions. I think getting out all the worst case scenarios, getting out all the fears, getting the reassurance you need. They might need a little extra support in the room, even having like an extra support person, bringing their own blanket. I don't know if you guys have had someone bring a pet, but I have in my office.
Times.
And like they might need extra, call them like objects, to kind of comfort them.
Just ground them,
And so I think it's like you just said, ask for what you need. Don't be afraid to keep asking questions if you need that extra reassurance, and that's what we're here for, is to provide that comfort and support and help you be able to get to that calm place. And definitely take the time to do some of the nervous system regulation stuff, because we can't like jump over that piece and have a positive experience in the infusion. If your nervous system is really hyper, active during the treatment, it is going to take away from the benefit.
I think lastly, just like emphasizing that this is unlike most medical experiences you have, where it really isn't a one-way street where the doctor is, telling you what's best for you and then you're following the practice. Like this, you're both deciding if you are right for each other. Whether you're a right candidate for the clinic and whether you feel like this clinic is right for you. Take your time, it's an important decision. But at the end of the day, once you do decide to move forward with it, really commit to it, and hopefully you find the right place. I think that's it for now. I think that was kind of as comprehensive as we can get about anxiety in one topic. So thanks for joining us. Again, if you have any questions, feel free to reach out to us. We'll see you next time. Bye.
Bye.